Staying with us, there has been a rise in attacks on emergency personnel in the Western Cape over the past year. The frontline heroes have had to bear the brunt of a pandemic and violent crime while trying to save lives. The Western Cape Health Department says between March last year and this March, there have been 78 attacks on EMS staff. That's the highest number in 5 years. Monique Mortlock has our story.
In the early hours of Workers' Day, 2 paramedics from the Lentegeur Hospital who were transporting a patient managed to evade an armed robbery. The incident happened in a so-called red zone, meaning emergency personnel can't respond to a scene without a police escort. Attacks on EMS staff have increased over the last year, hampering patient care.
We do see a deterioration in our response times because we are dependent on police escorts, on law enforcement, who themselves are severely constrained.
For staff, every day at work requires faith that they'll live to see another one. Paramedic Marco Rustin is one of them.
Waar ons nou onlangs een van onze paramedics en zijn collega een oefenlening gehad het, waar hulle aangevallen was door rovers en hy was gesteek en hulle dat kon so anders gewees het. Maar soos ek weer gesien sê, dit is maar net God en God se genade dat hulle daaruit uitgekom het en hulle kon lewend uitgekom het.
A recent internal survey found a third of the provincial EMS personnel showed active symptoms of post-traumatic stress disorder. That's about 600 members. It's double what previous surveys in other years found. Mental and emotional support services are needed now more than ever before for frontline workers.
What our staff are exposed to, we're not made, our bodies are not made to see carnage and abuse and the violence that goes with the calls itself, and getting there also putting their own safety, their own lives at risk.
Western Cape Health authorities say more work is needed to find effective solutions to keep staff safe. This means sitting down with the SAPS, safety bodies and communities. Monique Mortlock, Cape Town.